Welcome, everyone, and thank you so much for joining us virtually tonight. I'm Shelley Milwee, Vice President of Development for the American Heart Association. Our first choice would have been to gather in person tonight, but unfortunately, we were unable to do that. The health and the safety of our community and friends like you are the most important thing to us at AHA. Thank you for your flexibility as we navigate this new environment. Honestly, there's nowhere we'd rather be than with you. And if we have to do it virtually, then we will take it. We appreciate your time tonight. We want to share with you our vision of community impact in Montgomery County. If the pandemic has taught us anything, it has showed us that now is the time for us to address the critical gaps we have in health in Montgomery County. Since we have last gathered together in the ballroom in February 2020, seems like ages ago, the AHA has experienced many pivots in our work, in our environment, in our community, but never wavering in our commitment to save lives. Tonight, we are proud to take you beyond the gala table. Our work is more critical than ever. 75% of people hospitalized with COVID-19 have a high-risk condition, and people with high blood pressure, diabetes, or heart disease are even at a greater risk. On a national scale, we've been working hard to address this and learn more. In fact, we've established 21 rapid research grants totaling $2.5 million to better understand the implications between COVID-19 and cardiovascular disease. We've also developed a COVID-19 data registry through Get With The Guidelines, which has collected 21,000 patient records so far. We have established new guidelines for administering CPR, and more than 27,000 medical professionals have been trained safely through our We Can Help program. Friends, our community is struggling right now, and not just from existing health issues that we faced before the pandemic. In Montgomery County right now, life expectancy can vary up to 10 years by just traveling a few miles and changing zip codes. The biggest gaps we are seeing right now are in three critical areas: managing and controlling blood pressure, addressing women's health, specifically maternal health and mental health, and attacking food insecurity, which has become a global pandemic of its own in the wake of COVID. In the last 6 months, we've taken a radically different approach to our work. Together with the Montgomery County Board, we've met with leaders across the community. We visited with our neighboring community organizations to better understand the issues they are facing, and we are joining the table for the first time together to create collective impact like never before. We have set a bold goal to realize our mission. This year, we will continue to be relentless in our pursuit of a healthier Montgomery County. Join us and help us raise $1 million to achieve that vision. I'd like to toss it to our Montgomery County Board Chair, Kristen Offen, to share more about our direction and our new Heart of Montgomery County campaign. Thank you.
Thank you, Shelley. Hello, everyone, and thank you for joining us tonight. I cannot tell you how excited I am to be kicking off our Heartball campaign in a new and exciting way. I would love for you to think outside the ballroom and go beyond the gala table. We all love the Heartball, but this year COVID-19 has challenged us to think differently. This year, we are launching the Heart of Montgomery County, and through this campaign, it is our hope that you will continue to support the important work of the AHA as we expand our impact in our local community, working closely with companies to get their employees healthier and helping address the health of those that need it most in our backyard. Our hope is that you will feel inspired to support the work and open your hearts as we work together to achieve our goals. The Heart of Montgomery County campaign is a way to bring about transformative change to thousands of people's lives right here in our community. But we can't do it alone. We must convene others to have the greatest impact. There are so many organizations that are doing like-minded work. Tonight, I'm pleased to introduce a few of these critical partners that the American Heart Association is joining efforts with. We know that a healthy diet is a key ingredient for a heart-healthy life that is free of risk from stroke and cardiovascular diseases. And yet, healthy foods are out of reach for many of our Montgomery County residents. AHA sees this need in communities, and how to access healthy foods is vital to heart health and longer lives. Because of this, the AHA has forged new relationships with Meals on Wheels in Montgomery County and the Montgomery County Food Bank, which you will hear about shortly. Additionally, partners like Lone Star Family Health Clinics are seeing a sharp rise in patients who are suffering from uncontrolled blood pressure. Through clinical programs such as Target BP, in partnership with the American Medical Association and educational resources, the AHA will partner with these clinics to achieve better outcomes for their patients. Finally, the AHA has a science-based approach to corporate wellness and is partnering with companies across our community to promote healthy living and mental wellness. And we all know better health outcomes means more productivity in the workforce. But don't take my word for it. Here are some stories that are sure to inspire you all tonight.
Hi everyone, this is Karen Harwell, the Chief Executive Officer for Lone Star Family Health Center. I'm coming to you from our Conroe location where we serve over 30,000 patients in the greater Montgomery County area, and food insecurity and how that impacts hypertension is part of our daily lives here in the clinic. Most of our patients are low income, underserved, underinsured, and most also live in food deserts, deal with food insecurity, and get most of their meals from a fast food restaurant, a gas station, frozen meals, canned meals. And so this really contributes to a diet full of high salt, high fat, low nutrients, and all of that complicates things like hypertension, heart disease, diabetes. And so we're hoping to work with the American Heart Association really in a deeper partnership to bring better education and outreach to our patients, help them, inform them so that they can make better choices and really impact the way that they live so that they can have a healthier life and pass that on to the next generation, to the kids. And really we're just focused on prevention, much like American Heart. And so we're so grateful to have them as partners, and we know that we're going to accomplish a lot together. Our vision of having a healthy community and building a healthy community one family at a time will be much closer to that vision with the help of the American Heart Association.
Hi, I'm Christine Marlowe, and I'm the President and CEO of the Montgomery County Food Bank. It's my pleasure to be here today to tell you a little bit about what Montgomery County Food Bank and the American Heart Association are doing to partner as we fight this pandemic. So many people in our county suffer from food insecurity. And what that means is that many don't have sufficient access and reliable access to good, nutritious food. In Montgomery County, we have seen a 30% increase in food insecurity since the pandemic began in March. Many people have lost their jobs due to the pandemic and also are not able to afford to put food on their table. The Montgomery County Food Bank is proud to partner with the American Heart Association to address these food insecurity issues. We also know that food insecurity also brings about health problems such as diabetes and high blood pressure. So we have incorporated the No Diabetes by Heart curriculum into our cooking programs that we do through our nutrition education department. We are grateful for this partnership, and we look forward to working with the American Heart Association as we continue the fight against food insecurity in Montgomery County.
Thank you to Karen at Lone Star Family Clinic and to Christine at the Montgomery County Food Bank. Your commitment in pursuit of a healthier community is such an inspiration to all of us. We're so grateful for your partnership. Hello, everyone. My name is Larissa Jacobs, and I'm the Vice President for the Health Strategies team here in Greater Houston. As we continue to have thoughtful conversations on ways we can improve the lives of so many of our neighbors, the need for our work grows. Our teams have been hard at work identifying where the AHA can deliver our science-based research in both the clinical setting, but also at faith-based organizations and at community centers. We realize that we cannot go it alone. We're proud to say that in 6 short months, we've created alliances with the following organizations you see on your screen. Thank you to all of these important organizations for working alongside us to create a healthier world for our children and grandchildren. As Shelley mentioned earlier, one dangerous statistic we've seen is the rise of cardiac arrests happening at home. Our friends at the Montgomery County Hospital District have an important message for all of you tuning in tonight.
Before March of this year, when COVID-19 came to Montgomery County, we were averaging between 50 and 55 out-of-hospital cardiac deaths per month in the county. Since March, we have averaged as many as 95 out-of-hospital cardiac deaths per month in the county. Recently, the numbers have been trending down, and last month we averaged 70 out-of-hospital cardiac deaths per month. So the numbers are trending down, but they're not where they were at pre-COVID-19 times. My message to the public is, when you feel tightness in your chest or pain or tingling in your arms and shoulders on the left side of your body, or if you feel dizziness, call 911. Let us come check on you. We can hook you up to our heart monitor and check your heart rhythm and determine if you need to go to the hospital or not. If you do need to go to the hospital, Montgomery County is a great place to be because we have the best cardiac and stroke care in the region. We need to know more about the long-lasting effects of COVID-19 on heart health. We know that COVID-19 can cause enlargement in your heart muscles and in the arteries around the heart. We also know that COVID-19 can cause blood clots and problems in your blood vessels around your body. These can cause heart attack, it can create strokes, and it also can create difficulty with breathing and lung problems. More money needs to be donated so that more research can be done to determine the long-term effects of COVID-19 on heart health. We need money for continued research.
Such an important message, Randy. Thank you for all you do to keep our community safe. Many of us have also seen a dramatic shift to our work environment. Instead of working in an office, many of us are working from home. This can lead to a more sedentary work life, which also presents its own set of challenges: lack of physical activity, not eating properly, and your overall mental well-being. The AHA has robust corporate wellness programs and great experiences like the Heart Walk, where our corporate partners can ensure their employees are getting moving instead of sitting all day, like we're all doing right now. Maybe I should get up too.
We're all doing a lot. A lot of swiping, scrolling, and social media stalking. A whole lot of nothing.
So let's take a stand against sitting.
Let's care more about strolling than scrolling. Let's make moves together, starting now.
Ha! You caught me. Seriously though, our message cannot be clearer. We have to get moving, and there's a perfect example of a company who clearly has the heart to take on this challenge. For many years now, Kiewit has adopted a culture of health, challenging their employees to take control of their heart health and rally behind a cause.
It is very important for companies to support the AHA and our programs like the Heart Walk for a couple of reasons. There's obvious reasons about the financial support that goes towards the campaign and the AHA. But the most important in my mind is the volunteerism and the camaraderie and the feeling of our employees that they are getting to participate in something that has such a worthy cause. In the corporate world, it is so important to keep our employees' health at the forefront. The AHA does that, one, by making sure that people have good heart health, eating healthy, getting out and exercising, but also offers corporate America things like training for CPR and many other blood pressure events that really add value and support our employees' health and well-being. It is so very important to me personally for the same reasons that it's important to our employees. Everyone has been touched by and knows someone that has been affected by a heart-related illness. And the support that myself, my wife, and all of our employees at Kiewit give is so vital to ending that tragedy and allowing us to live healthier lives.
Thank you, Brad and Kiewit, for all you do to keep your employees healthy. Shifting a little bit, I want to introduce you to a very special young lady Julieta Valdez knows all too well the importance of calling 911 and how CPR saves lives. At the tender age of 16, Julieta Valdez, a high school sophomore from the Woodlands High School, suffered a cardiac arrest. Instinctively, her mom and her sister sprang into action. Here is Julieta's story.
Hi, my name is Julieta Valdez. I'm 16 years old. I'm a student at the Woodlands High School and I play volleyball for Houston Juniors Volleyball. And on May 3rd, I collapsed and my heart stopped. So to give you a little background of how my life was before, I've always been a very high intensity athlete, but I never expected to have any health issues like I did on that night. I was doing push-ups with my sister and I hit my head and I collapsed. And that's whenever my family knew that there was something wrong. So my sister instantly called up my mom and my mom began performing CPR while my sister called the 911 dispatchers. And they proceeded to guide her through proper CPR for about 6 minutes until the paramedics and the EMTs arrived. So my sister and my mom kept on switching on and off. But in total, I remained without a pulse for about 23 minutes. And after several resuscitation efforts, the paramedics and the firefighters were finally able to put a pulse on me and transport me to my local hospital. After spending a couple hours in that hospital, I was taken to a hospital a little farther away from my house that had better resources. And there I spent about 2 weeks in the intensive care unit and about 1 week in the regular room. And now I've come out on the other side. So after educating myself and finding out everything that my mom and my sister did for me, I really wanted to spread awareness for people who don't know CPR, which is one of the most basic forms to save a life. Now I've partnered up with the American Heart Association to bring awareness to such a cause. I'm living proof that CPR does work. It's because of CPR and because my mom and my sister acted quickly that I'm able to have the life that I have today. So I'm really grateful for it, which is why I feel like I owe to give back and make sure that everyone around me knows CPR and that people know how important it is and how you can save a life doing it. So I'm so thankful to be partnered with the American Heart Association that they're letting me share my story and share my values of how important I feel CPR is. So to the American Heart Association, I'm super, super grateful and I can't wait to see what's next.
Julieta, thank you so much for being such a brave and strong advocate for the AHA. Your story is an inspiration to all of us and is a constant reminder why we must continue the work of the American Heart Association. We want to thank you all for those who have already committed to support our campaign this year. As of today, we have raised $152,500 towards our $1 million goal. Our campaign has just started. Our goal is to hit our milestone of $500,000 by December 31st, and I know we can do it. In fact, National Day of Giving is December 1st. We know the generous spirit of our community. It's unwavering. When we put our hearts and our minds to something, there is nothing we cannot accomplish together. Will you join us and support this important campaign?
Hey everyone, this is Kristen.
And Matt.
Kristen and Brad Kaufman.
Hello.
Kristen and Chris Kirsch.
Hello everyone. This is Mickey and Natalie Moon.
I'm Justin Kendrick, Senior Vice President and CEO of Memorial Hermann the Woodlands Medical Center.
And this is Diane Freeman. U.S. Anesthesia Partners Texas is proud to sponsor.
As longtime supporters, volunteers, and leaders of the American Heart Association,
Memorial Hermann is so proud to support the Heart of Montgomery County campaign.
Centerpoint Energy is proud to support.
We are proud to support the Heart of Montgomery County campaign.
Thank you for joining us this evening.
Stay safe and stay healthy, everyone.
Thank you to all of you who have already committed to this campaign this year. It is because of all of you that our work is possible, but it's not too late to support. After this event, we will send you an email with all the details and the ways to get involved with our campaign. Mark your calendars now. Our Heart of Montgomery County campaign virtual celebration experience will be happening February 21st, 2021. From VIP party packs from your in-home experience to a live auction to a silent wine auction, you won't want to miss a thing. Before we leave you tonight, we want to share a fun video from our dear friend and fellow Montgomery County board members, Dr. Silvana Molassi and her husband, David Erweiler. The next time you have a glass of red wine, you will think of Dr. Molassi telling you it's okay, but only in moderation.
Hello, I am Dr. Silvana Molassi. I am the Associate Chief for Cardiology at Texas Children's Hospital, and I am a member of the Board of Directors of the American Heart Association for Montgomery County.
And I'm her husband, David Erweiler. I'm a Managing Director with EY.
We are here tonight actually to talk about heart health, and yes, we are holding our glasses of red wine. Cheers! So, as you know, it is extremely important to take care of your heart. What does that mean? It means that you need to see your cardiologist, you need to eat a healthy diet, walk, do whatever kind of exercise activity that you want that makes you unwind and relax, especially in these very challenging times. And yes, what happens is that red wine can help keep your heart very healthy, keep your blood pressure under control. How does that happen? It is because the red wine has some specific types of substances that actually helps the lining of the blood vessels and maintain your blood pressure, as well as other benefits to your heart, to the heart muscle itself. Some of them are called antioxidants. And we are here to talk about a very important initiative that actually the Montgomery County American Heart Association Board, and an initiative that I think you all can help us with.
Yes, as wine lovers, we're very happy to announce that in February, the Montgomery County American Heart Association is going to have a wine auction. And this is an opportunity for all of you to contribute and help give to this important cause.
So what can you do? Open your cellars and see what do you have. Oh, those amazing Bordeaux's. Or how about those fantastic cabs from Napa? Yes, those ratings that are 93, 95, 97, 99. Yes, please donate a bottle. And this is going to really help a wonderful cause. It is going to make us be very, very successful and will help us, more importantly, to fight heart disease. So please join us, cheering for the success of the event that we are planning for the Montgomery County American Heart Association. Cheers.
Thank you, Silvana and David, and cheers to you all. To learn more about how you can support the Heart of Montgomery County campaign or even our fabulous auctions, please connect with Angela Garza. After this show, she'll be reaching out to each of you with ways you can support. And thank you so much for joining us. We appreciate your support and thank you for your commitment to the heart of Montgomery County.